Hi, everybody. My name is Luis Villa. I am originally from Spain, and I am living in New Zealand for the past 12 years, and I am a physician.
Hi, I'm Trish. I'm an RN and an academic. I teach global health to nurses and midwives. And my area of research interest is climate change and human health, and anything to do with emergency medical humanitarian assistance.
Kia ora, my name is Bronwyn Locke and I'm a qualified nurse and midwife living in Wellington, New Zealand, Aotearoa. Some of you might remember me as Bronwyn Hale. I was the Women's Health Advisor based in the medical unit, Sydney, Australia.
My name is Emmanuel Ladeville. I am 47. I'm based in Canberra and I'm working in the health sector in operational and project management roles.
Hi, my name is Amy, coming to you at the moment from Mosul in Iraq. Thanks for taking the time to check out our video.
Kia ora, hello. My name is Chatu Yapa. I am in my early 30s. I am a medical doctor specialising in public health. And I am a Sri Lankan born, Samoan bred Kiwi, now living in Canberra.
Hi, Dwyn Tucker here. I'm standing for re-election at the AGM. I've been on the board the last 3 years and would love to serve another 3 years if I may.
G'day, my name is Don McCallum. From 2010 to 2016, I completed 10 MSF field assignments in 8 countries, covering most types of MSF's medical interventions. While my technical background is as an engineer, I have a PhD in 3D printing, I work in MSF-related fields like medical technology, bioengineering, biochemistry, and disability technology.
I think I bring my enthusiasm, that's clear, and I also bring my experience in MSF. I joined MSF a ridiculous amount of years ago, which just makes me old.
Well, I've been involved in the movement for about 10 years and I've been on the board for almost 1 year. I've been orientated to the Governance and Association Committee and I've been mentored by, I think, some of the best on the board. I've done some training in Amsterdam with OCA, governance training, and I've also done crisis management training, and I think it's a bit like a field mission. It takes about a third of your term to know what you're doing and be effective, so I'd like to pay back MSF for what they've invested in me and continue my service on the board for the next 3 years.
So what I bring to the board is my extensive life and work experience, in particular working for Médecins Sans Frontières and other sexual and reproductive health related NGOs in New Zealand, and my current role in a government crown entity with a governance role.
First, on a day-to-day basis, I think I can contribute to shape MSF main orientation, and this mostly because my field operation and head office experience give me a solid mix to both understand the very field context and constraints our ops evolve in today. It also gives me a good sense of what we deliver at field level and how the organization makes it happen.
A lot of recent field experience. I've done 6 missions now, this being the 6th, with MSF in the past 3 years. Before that, one, Ebola, with the Red Cross. I've worked predominantly in the Middle East. 5 of my missions have been in the Middle East.
What do I bring to the board? I bring lots of operational field experience with MSF. I've done 6 missions since 2012 to last year. I also bring lots of knowledge and expertise in public health, and I'm doing a PhD actually on humanitarian health and primary health care, specifically looking at service delivery. I also bring lots of energy and enthusiasm and dynamism, I think, to teams.
I'm the current treasurer and I'm also the chair of the Branding and Resource Committee, and I'm on the Remuneration Committee and chair the 4 treasurers meetings as well. I was, prior to this 20 odd years ago, a director and founding treasurer, and I hope I add a lot of value in a non-medical way. My background is running companies. I've run 7 different companies, as well as having a depth in finance and marketing.
The MSF's board skills matrix currently lacks a strong technical and logistics profile. I feel a strong logistics voice is needed to complement the talents already on the board to guide the board through the hullabaloo around innovation, medtech, big pharma, the Internet of Things, Industry 4.0, autonomous vehicles, machine learning, artificial intelligence, grass skis, and jetpacks. Sorry, forget the grass skis and jetpacks, that was from the 1980s. My professional work involves complex budgets and finance, human resources, governance, strategy. I'm no stranger to these domains. I've sat on numerous boards and been an office bearer on a number of political and industry bodies.
To explain it quickly at 3 levels. The first one is here in New Zealand. I think we have a fantastic group of people in New Zealand in the association, and we could just work to strengthen that support, the support that we provide to MSF Australia and New Zealand. Regionally, we should be working to strengthen our operations in the region and just finding ways of how we can be more meaningful to the organization from an operational point of view. International level, well, we've been challenged recently by our international office on how to rethink MSF and how to adapt to those changes.
Interested in governance, really, and the bigger picture. So I'm committed to field autonomy and making sure that growth happens where it benefits patients.
Is the whole spread of responsibility, but if I'm honest, the diversity and inclusion discussions, because of course people are pivotal in everything, and we need to be really bold with some of our decisions.
I also believe I can help MSF through a number of main issues the movement deal with, and we'll have to keep working on hard in the future. Follow up and curb unhealthy HQ growth trend, follow up and tackle operational center double up toward a less European-centric movement and toward increased operational coordination, push further towards fair and equitable staff management, staff development, and national staff involvement.
The call for change statement that came out recently from the International Board really resonated with me, and I would love to be a part of working with MSF to try and progress some of the issues that were highlighted there. The need for increased medical relevance is something we grapple with daily in the middle income and secondary healthcare settings. The other really key aspect, I think, of that call for change was the need to really understand who our staff are and how we support them. For me, the really big moment for that was spending so much time with the clinical officers in South Sudan and trying to, I guess, be a part of a shift away from a Eurocentric organisation to really being one that represents who we actually are and who are our staff that are meeting the needs of patients on the ground.
I love MSF and I love the work that we do, but what I'm really interested in is to see how we can make it better. I think that we need to look at how we can improve quality of care that we give for patients. And I also think that we need to think more and deeper about how we can engage communities in the way we deliver services, so that it's not a top-down intervention or top-down approach to how we provide services, but we really look at engaging the community and adapting our interventions to the local context.
We're undergoing quite a lot of change, particularly a structural deficit worldwide. Still questions around global footprint, a change of leadership here.
If I'm not elected to the board, I will continue working as much as I can in the organization anyway, of course, as I did in the past.
Well, it wouldn't be the first time. I'd probably have a drink, pull myself together and have a go again in the future.
If I lost, I would cry. I would then get on my bike and continue to engage with the MSF Association, as I already do. I am a peer supporter for departing and returning volunteers. I am part of the MSF political liaison strategy, and I am active with the MSF meetups, having recently reactivated the MSF Canberra sleeper cell. And I continue to mentor for a small NGO, Engineers Without Borders.
I hope that I will see you in the AG, and we will have a great discussion, and of course have a couple of beers or a couple of glasses of wine.
I'm a really big fan of Martin Luther King. He's up here in my office wall, and when I was a teenager, I wanted to marry him.
I look forward to catching up with old friends at the AGM in Sydney, meeting new association members, and for those of you who are association members voting online or by proxy, ka kite anō.
My belief and commitment in MSF principle and ethics are as strong as ever, and have probably even been reinforced over time. To conclude, put aside my kids and family, there is nothing that gives me more pride in my life than my association and the time spent working with MSF. I'm looking forward to further meet and discuss with you all, MSFers at large, in Australia and New Zealand very soon.
I will be back in Australia from the middle of June and working in Alice Springs Emergency Department. Really happy to bring a part of representation of the Northern Territory to the board.
I hope I can continue to add as much value as I try. I've attended all the board meetings over the last 3 years. I live in Sydney, and I look forward to seeing at the AGM, and hope you can vote for me as many times as you can, please. Bye.
If I'm ever stuck on an issue at a board meeting, I'll bring in my favourite text from the 1930s, Mr. Chairman. This book has become the standard text on meeting procedure in Australia. It's a cracker.
Yes. Bye. Adiós. Hasta la vista.